Okay, so I'm here with Sharon. Where are you from, Sharon?
I'm from Sherman, Texas.
Okay, nice. Now, what, where were you before we started working together? What was your situation?
Um, I had been in the hospital a couple of months prior with TIAs. I was very lucky. I had no permanent brain or heart damage, but I was overweight and I needed to lose weight to take care of my heart health.
Okay, and what progress have you made since working with me and the team?
I have lost 20 pounds, and I'm very happy to say that with the healthy lifestyle changes that y'all have encouraged me to implement, my doctor has taken me off my high blood pressure medication.
Wow, okay, so you're able to essentially you're managing now the high blood pressure and some of the risk factors through your diet and lifestyle changes.
That is true.
Okay, and it's been 20 pounds, and what are we now? 4 months, right?
Yes, we're 4 months in.
Fantastic. So, what do you like about my program or my approach in particular?
I really like all the support. Y'all help me with not only knowing what I should eat, but helping me to work with some of the reasons of why I've been overeating in the past. So that's been a tremendous help. Um, I like that you tell me everything I need to do to meet my goals, but no extra fluff, just exactly what I need. It's, this program's just been exactly what I needed to lose weight and get healthy.
Okay, so telling you what to do with the direction to take, what to focus on, what not to get distracted by. Um, and then also there's the mindset piece, right? Which I guess you kind of touched on about because it's not only knowing what to do, then it's actually doing it right and not falling back into old ways. Do you feel like it's helped with your mindset or relationship with food, or what do you think?
It has helped a lot. After I got out of the hospital in May, I tried for 2 months to lose weight on my own, and I did not lose a pound. So dealing with my relationship with food has helped a lot.
Okay, what do you think you learned in this approach with me that's different to approaches you did in the past or diets you've done on your own? Like, how come this one was successful for you, do you think?
All the support that y'all give me is a big part of it. Another thing is that you teach that you can have the occasional treat. Always in the past, I could be very good for a long time and eat exactly what I should. But then when I fell off the wagon and had one treat, that was it. I might be bad for 5 more days. I might be bad for 5 more months. I just couldn't get back on track. And I mean, for instance, last Saturday, Beth had me to have a treat. So I had 2 cookies Saturday. I was happy. Probably the first time in 45 years that I've had 2 cookies and stopped.
Wow. Okay. So it was, yeah, it was clear that your relationship with food there was different. Um, Sounds like you didn't feel guilty, but you also didn't feel like you wanted to have more.
Right, right. One thing that your program has done for me is that you really encourage me to figure out what my goals are so that I know exactly what I'm working for so that all this work will be worth all the effort. That's been a great help.
Awesome. I love that. What would you say, Sharon, to someone who is sitting on the fence and they're not sure whether they should do this program with me or not?
I would say go for it. It will be the best thing you ever did. Um, I'm just, I think it's great. I've tried many, many diets in the past, and this is the first time that y'all have taught me how to maintain into the future. I mean, I know that I'm going to get all the way to my goal, and I know how to stay there. And if I fall off the wagon for an hour or so or a day or so, I can just get right back on and continue on.
How far are you from your goal anyway, from what we said when we started out?
About 8 pounds.
Okay. And you're confident you're going to get there. The important thing is you're confident you've got the skills and knowledge to stay there.
Right, right. Both of those. I'm confident that I will get there, and I know I'm going to stay there.
Okay, fantastic. I mean, do you want to add anything else? I think we kind of covered everything there.
The other thing I will add is that y'all are really fun to work with. I've really enjoyed working with you. And I would just encourage anyone to just jump off the deep end and go for it.
That's it. How did you have the courage to, I don't know, to invest in yourself and do it? What's the secret?
I really needed to work on my health and improve my health. I'm going on an international trip in about a month, and I need to be in good health to do that. If I hadn't have had the help of this program, I might be staying home all December instead of traveling.
Okay, I thought of another question. So with our approach, it's very much diet focused. Sharon, you know, mobility, you know, do you want to talk a bit about your mobility limitations and the fact that that didn't stop you from getting to your, you know, getting almost to your weight goal? And, you know, we still have some time to go, so we'll get there. But, you know, exercise is not required, right?
That's true. And that's a great point about this program. You get to decide if you want to exercise or not. I have scoliosis, so I am somewhat limited in what I can do.
Mm-hmm. And so sometimes you've been doing physical therapy, but it's not like that, you know, you had to work your butt off or something to get to the goal. It's the complete opposite, really. We're trying to show you can do it with diet alone. If you rely on exercise to get to your weight goal, it's actually not a good thing, because as soon as you stop, when you go away or you get injured or you physically you can't, or you're not motivated, if you're relying on exercise, you'll gain it back.
Right. That's very true. And that's a great part of this program.